speaking to Zahira
Hello.
Chandler? Hello. Am I speaking
Uh,
to Zahira Chandler? Is
yes, doctor.
it okay if I address you as Zahira?
Yeah, it's okay, doctor. You can.
May I confirm your age, please?
Yeah, I am 30-year-old, 29-year-old.
Zahira, I gather from your notes that you're 28 weeks into your pregnancy and you want to discuss your mode of delivery. Am I right?
Yeah.
Okay. Are there any other concerns or expectations from this consultation?
Uh, I wanted to go for cesarean section, doctor. That is only concern, and that's the reason I discussed this with midwife. She said that I need to see you.
Okay. So surely in the next few minutes, I'll be addressing all your concerns. Before that, is it okay if I ask you some questions so I can understand you better? And then we'll go through a management plan. Is that okay?
Oh, that seems fine.
Okay. And in the end, I'll give you also some written information and fix an appointment with the consultant. That back to the GP as well.
Yeah, good.
Okay. So now, can you tell me in your own words, how has your pregnancy been so far?
Oh yeah, the pregnancy is planned pregnancy. Me and my husband are both very happy. Everything is normal so far as only mild vomiting I had initially, but now everything is normal, doctor, including my blood test and my ultrasonography detailed
Okay.
scan.
Okay. Congratulations on your pregnancy. Did you take folic acid in the first few months of your pregnancy?
Yes.
Okay. And are you feeling the baby movement and have you named the baby yet?
I have not named, but yes, my baby is moving quite good.
Okay, that's good to know. And any other concerns such as pain in the tummy or any
Oh,
bleeding?
doctor. No, no, no.
Okay. And do you feel any blurred vision or headaches or any other concerns?
No,
Apart from this, uh, have you ever had any surgery in the tummy or down below?
no.
Okay. Is this your first pregnancy?
Yes.
Okay. And any other medical conditions for which you see a general practitioner?
No,
Okay. And any family history of concerns such as raised blood pressure, raised sugars?
no.
Okay. And when your last scan was done, was the baby weight or the
This is
size
a
of...
detailed scan at 20 weeks around, doctor.
Okay. So that was done.
Yes.
Okay. After that, no scan has been done.
No.
Okay. And and how's the support at home? What do you do for a living?
Uh, I am actually working in the
Mm-hmm.
departmental store, and I'm married to my husband. So the whole support is very good. I don't have any problem.
Okay, that's good to know. And are you aware of your weight to height ratio?
Yeah, it's normal. I am actually looking forward to go into this film industry. That is another reason I don't want to uh, have any bad if means if I don't want to give birth because of that. That
I
is reason.
understand. I
Mm.
understand. Okay, and are you aware of your blood group or any reservations for blood
No,
transfusion if required?
no.
Okay, and it's okay. Then we'll check your blood group. Thank you for sharing all of this information. Is there anything more you'd like to add?
No, doctor.
Okay. I would just like to examine you in the presence of a chaperone and just checking your weight, blood pressure, your heart rate, your breathing count, and your tummy and baby heart rate as well. Is that okay?
Okay.
Okay. So, Zahira, coming to your concerns, may I know the reason behind opting for cesarean section?
I told you, doctor. One is I'm looking forward to getting into my some model consignment, and another
Mm-hmm.
thing, my friend had a
Mm-hmm.
very bad experience. She had a very nasty tear in her back passage, which took so much of time, and she used to sting, lose means fetus, fat, flatus. So it is very embarrassing. So I just want to go ahead with all those things.
I'm sorry that your friend had to go through that. How is she coping now?
She is okay. She now it has been healed.
Mhm. Okay, I would like to reassure you that every woman has a choice to have the mode of delivery that they wish to, and every woman goes through the labor and pains differently. Every body is different. We do have the options of undergoing vaginal delivery and as well as cesarean section. Seeing that all your reports, your blood pressure and your scans have been normal until now, it's a very normal and low risk pregnancy so far. So good. What we would be doing is we'll be making sure that we'll continue monitoring your baby growth from now onwards via growth scans. We'll also be involving the my consultant, the sleep doctor, to see if at all there is any reason that we'll have to undergo cesarean section. So usually with cesarean section, if the patient undergoes labor via that, the benefits is that obviously you're not going through labor. There is no pain associated with it. It is a faster process that you're delivering the baby. But it also comes with its own risk, the risks of sleep, that is the anesthesia risk. There's also risk of infection of the wound. Sometimes there is excessive bleeding during the delivery, and there can also be injury to the surrounding structures such as bowel, bladder, and that can also. Sorry,
Okay, got it, doctor. So,
are you
means
following me?
it's that risky, doctor.
So everything comes with its benefits and risks, and usually we do an entire checkup before seeing that if a patient is fit for the surgery as well. Secondly, it can be that risky as well. It can be there can be a prolonged stay at the hospital. Sometimes the skin to skin with the baby also does not happen. If at all we go with vaginal delivery, do you want to hear about it as well?
Yeah, doctor, because I am worried about that nasty fear.
Yeah. So with vaginal delivery, the benefits is that one, the you're going through the natural process of birth, you're delivering, and the baby you will be in touch with your baby immediately. Skin to skin contact will be there. There will be early recovery, and you will be given discharge from the hospital as well early. But it comes with its own risks as well. That sometimes there can be prolonged labor. There are chances of the tear as well in the first time. Sorry.
I'm just worried about that tear. I don't want to experience
Yes.
any such tear.
Okay, I understand. So to prevent that tear, there is a chance of 6 in 100 women who are first timer delivering the chances, but the chance is also less that we can prevent it if we are giving proper support. When the patient is in labor, we are giving proper support and care, and we are doing warm compressions during the labor. All of this can be avoided if the delivery is under a skilled train. All our midwives and all our doctors are skilled and trained and only are allowed to deliver once they are signed off. There will be monitoring of the baby heart rate will be done, and when you're going into labor, we'll be making sure that these complications are avoided. Are you following me?
Okay, yeah.
And if at all the baby, so even before delivery, we'll be checking for the baby's weight, and we'll be seeing if the baby is head down or if the baby is what is the position, and then we go ahead with the vaginal delivery, and we'll be taking all the precautions to make sure that such complications do not occur. In some scenarios, if these complications do occur, we will be taking utmost care of you. That the stitch will be done under a trained doctor, which will be the consultant, and post care will also be given the delivery. We'll be making sure that the hygiene of the area down below is maintained. Then the wound health, we'll be making sure that when you're going to the washroom, you're only tapping these stitches, and if at all there is pain, adequate pain management will be given. IV antibiotics will be given if there has been any complication that occur. Are you following me?
Okay, doctor, this is so much. Means you are telling me so many things actually as of now. Okay, I will think about it.
Have you thought about what you would go ahead with?
I will think, yeah.
Okay, so don't be worried. We'll always be there at each step with you. If at all you have any concerns, you can contact us anytime. And in the next few weeks, I will be making sure that we fix an appointment with the consultant. So again, you can come and think about it and discuss with the consultant as well. I'll be writing back to the GP, and now we'll be doing a growth scan from as your 28 weeks. We'll be doing a growth scan and monitoring the baby's growth as well. And we'll be checking for your full blood count as well. Is that okay?
Okay, thank you.
Thank you for your time.
Last 8 seconds. Okay,
Yes, ma'am.
well within time. Would like to, I mean, this is Dr. Fakia. Would you like to give a feedback? I would like to listen to you.
Yeah, she has a very soft and very soothing voice. I
Mm.
enjoyed the way she talked, and I appreciate that she started with the positive points of cesarean section, and then she talked about the negative points, and then she came to vaginal delivery. She talked about the positive and negative. Both was very good, but I was little bit concerned when she was talking about the management of the tear and all. I think we can cut that short and.
Mm.
Then give her written information. I think she missed giving because you said that it is too much to take home. That part
Yeah.
I thought that written information she is asking about.
Mm.
And she needs a counselor for it also. I don't
Yeah.
remember, Mariam.
Forgot.
Yeah, she has not said anything about. See, this is what is this? It is social media.
Counseling, yeah.
So this is all about express. Let her express her fears and give her a counselor, even CBT, that is talk therapy. And yes, her care will be under consultant care involving the. Please unmute yourself. So Uh, So actually, the care will be, it will be a named midwife, because then these kind of patients will always have a fear about changing their midwife. So she should be under the named midwife, counselor, perinatal mental health specialist, especially counselor initially. If not, then involve the psychiatrist, consultant, and ascertain her fear. Okay, so ascertain her fear and allay her fear away from this. She is not having any fear regarding pain. She's having only fear regarding her figure. She's having another fear regarding the tear. Okay, so those two only we need to allay. Otherwise, this is straight station. You just need to communicate with the patient. Okay.
I didn't know if I was supposed to say more about the tear or give her
No,
idea.
no,
I
no,
completely
no, no,
forgot
no,
about the
no, no, no.
counselor.
Not actually, but emphasize more on counseling part and counselor.
Yes.
This is also patient safety. Apart from patient safety, this is another station which comes into communication with patient category. Because here again, you have to convince. This is a negotiation task. So that
Yes.
negotiation part you had done very nicely, because you know that what I wanted to listen, you had told me first positive followed by negative, then you tried to explain me why vaginal delivery is there. But what are the pros of vaginal you mentioned? What are the risks associated with vaginal?
Okay, ma'am.
So, what are my chances of going for cesarean section during vaginal? What are my chances of going for operative vaginal delivery? And if it is operative vaginal delivery, what are my chances of having third and fourth degree perineal tear? And how you are going to take precautions to minimize? You had covered that part. That antibiotics and all those painkiller and all those things, we do not need up to that point. So, that is not needed. But more on counseling part, that is one thing. You are having a habit of combining 2 or 3 questions at a time. How is your baby movement? Did you name your baby? Will you accept blood? And what is your blood group? So please avoid. Okay,
Okay. Mm.
so you are having that. Uh, why you think that you want to ask me here why I'm having pain, why I'm having my blurring of head, vision and anything? I told you in the beginning that absolutely nothing. My pregnancy is going smooth. That means you have to take it that I'm having a low risk pregnancy. And midwife, I just discussed this with the midwife, and she said, no, I need to go and see you. Got my
Mm.
point? Okay. So
Okay,
take it
ma'am.
as a negate, means max to max, you can just check her, or you offered me examination to see whether my what is my BP. You can say that also. Anyway,
Okay.
when your patient comes to discuss any report, mode of delivery, examination is not needed, but still you can discuss. Okay, that is one point. Then uh, why growth scan? Why serial growth scan I am needing?
ANC all 28 weeks onwards, 1 monthly growth scan. So I said it that way.
No. Which
Okay.
part of the world you are there? In UK, they do not go for growth scan. They do nowadays a last scan nearing term. Okay, 36 weeks
Major
around they
fundal
will.
height is supposed to be done. Yeah.
Yeah, then that time only they will discuss. But in general, no. In general, no growth scans, no repeat growth scan, no serial growth scan. Yes, you are going to
Okay.
arrange ultrasonography to see how the baby is and what are her chances. Okay, so you are going to arrange ultrasonography. That is not a problem. But no growth, serial growth scan. Hmm? Mind it. Hmm?
Symphysis fundal height will be done.
Yeah, symphysis of fundal head. She will be in a joint care. So she will be monitored by a named midwife. So that she will
Mhm.
have some rapport. Every time if she has been seen by someone else, she will not going to express her
Yeah.
ideas here. Okay. So she will be seen by a named people and consultant will be discussing and communicating on time to time basis.
Mm.
Okay. Got it?
Yes, ma'am.
Okay. That is what. So that history is not needed here. Blurring of head, BP, and pain and any discharge. Okay. Okay. That history is not needed. Okay. So rest of the history was perfect. Now coming to the uh, my answer key. Introduction, situational awareness, aim, discuss mode of delivery, concerns. Why you here you didn't ask it, you asked it sometime later, it's okay. Situational awareness, anxious, okay, because I don't want. Here also you can ask her why not. Fear for vaginal delivery because one is figure and the second is bad experience of the field. You address both the concerns. Okay, you had not addressed my figure but you had addressed that second concern. Tell me in detail about this pregnancy. Weeks, booking blood test, any problem, complications in the pregnancy, named baby, fetal movement, future baby. Okay. How many babies do you wish to have in future? Because that is again important point when it comes to counseling the patient. Blood group, BT. Arrange ultrasonography if not, and whether she is corresponding by date. Any surgery, medical condition, mental history is important. Many a times they do have some anxiety disorder because it's a tocophobia and support. Rule out any abuse is there. Okay, so any abuse, because this is phobia, fear, anxiety, this all comes into that mental history, so it's always better off that
Okay.
you will ask this history. Allergy, smoking, alcohol, occupation, no need to ask drugs. Okay,
Okay. Okay.
smoking is also you can skip, alcohol is also you can skip, even allergy you can skip, because pertaining to this we are not having any interaction or any yeah. Means as
Okay.
of now we are not going to give her any means intervention, we are not intervening in any way. Okay,
Okay.
then now here you can ask her and means emphasize on her views regarding the labor. Okay, emotional vulnerable, arrange counselor, whether there is any family history of depression, because then you have to ascertain that she is at increased risk of postpartum depression. Does someone accompany you, at whom do you stay with, and all those history, just to build a rapport with your patient, because you need to build a rapport so that she will open up. Explain her about pregnancy, that okay, so looking at your pregnancy, it seems to be a low risk pregnancy as everything is normal so far as, and the low risk pregnancies are having the least complications. Okay,
Yes,
including
ma'am.
birth trauma like oasis. So this kind of pregnancies most of the time progress very well, they go into spontaneous labor, they deliver without having a many means major complications. They can have a minute tear. Okay, they can have a minute tear, but most of the patients will not have. And her options are vaginal delivery, which she is not keen, and another option is cesarean section on request. And she is having, you rightly mentioned, I will respect your views. Yes, we do respect whatever you choose for yourself. I am here just to explain you pros and cons of both the options, and then you can choose what suits you better and safer.
Okay.
Okay, so what is safer and better option for you, so you can choose it. So negotiation is a part of this task. Positive, or what woman wants to listen first, then most suitable options. It is not uncommon to experience some uncertainty or anxiety giving birth. More severe fear of childbirth is known as tocophobia. It happens in 14% of the women. Okay, so what she is having is a fear of normal vaginal birth, so it is known as tocophobia. And then what are her options? To have a planned cesarean section at 39 weeks. Please say this: at 39 weeks
Okay.
only you are going to go for a planned cesarean section. So what she understand by having that? Yes, it's a safer method when it comes to delivering a baby if done planned. uh, she can select a date. mm. Surgical modality involves surgery, anesthesia. Okay. uh, Planned surgery at lowest complication, but still there are certain complications associated with this, as rightly mentioned by you: bleeding, infection, readmission, cut on baby, prolonged stay, delay in the hospital, delayed bonding with the baby. These are the current complication. In future she can have a risk of scar giving way, needing LSS and adherent placenta in subsequent pregnancy. So these are the some concerning, okay, some frequent complications what she can have, but some more complex complications like injury, excessive bleeding requiring blood transfusion. In the events of some untowards complication, series of events may happen requiring need of removal of womb and may turn life threatening at a time. Okay, so these are also associated with surgical modality, and we cannot deny this possibility also. I am here not to frighten you, but to give you all information clear in a clear manner. Okay, for the baby, it do have more risk of, these babies are at risk of asthma, obesity, diabetes in future. 1 out of 4 primary gravidas, or the women who are delivering for the first time, go for cesarean section for various reason if they goes in labor. Okay, so we are not denying at the same time that if 4 women are going for 4 primiparas are going for a vaginal delivery, 1 out of them will go for a cesarean section. And the alternative options are vaginal delivery or operative vaginal delivery. If it is a spontaneous onset, okay, everything is normal, then the chances of complication least. This is more simple, more natural way of giving birth. You can bond with your baby. You can go home on the very same day. Less painful compared to cesarean section, but it is associated with risk of injury to the perineum. Mm? These are preventable in
Okay.
most of the cases. We need to identify the risks in her case. Then this OAC care bundle plan is there, which can minimizes the risk. So here you can just ask her, what do you have? Are you aware about this OAC care bundle plan? No. This means doing a pelvic floor muscle exercises from 32 to 35 weeks onward, perineal massage, perineal support, perineal massage, warm compression during labor, episiotomy, and examination. Okay, post delivery examination to diagnose it on a priority basis. So all these will be a part of this OAC care bundle plan. If patient is keen, you can explain her. Now she is 28 weeks, from 35 weeks onward she can continue pelvic floor muscle exercises strengthening. However, 1 in 3 women may need a instrumental delivery. Okay, but in the hands of the expert, it is still safer option compared to cesarean section. Okay, operative vaginal delivery, if it is a outlet forceps, don't you think it is safer option as compared to cesarean section? It avoids the risk of surgery, and it increases the future vaginal birth probability in future. So this is also a better options as compared to cesarean section. And the fear of childbirth, it is known as tocophobia. Since, I mean, these are the information related with your mode of delivery, but if it is taking a toll on your mental health, I will be involving perinatal mental health specialist, especially counselor, a talking therapist, a named special midwife, okay, consultant, for further care and counseling. Okay, so these people will be involved for further care and counseling. They will talk to you, they will give you idea, express you, and come being in touch with the people who had similar problems in the past. You can talk to them. You can also talk. Means another thing is also there which we will be discussing. What is the role of prevention of prolapse and this SUI in cases of LSCS? Can you somebody answer this question? If the role player asks you, okay doctor, but I heard that it prevents the future prolapse and this urinary incontinence associated with normal vaginal delivery, so what it is, what will be your answer?
Ma'am, we will answer that yes, your concerns are valid. Basically, when we are going for vaginal delivery, because of the passage of the baby, the muscles can get weak. Uh, uh, and after the delivery, but if after the delivery the woman does good post-delivery exercises, the strength of the muscle can be regained.
Yes.
This is what we need to do after vaginal delivery to come back to the normal.
Yes, and cesarean section is not recommended to prevent prolapse or stress urinary incontinence is future. Okay, so this is not a
Yeah, this
recommended.
is not an indication. Yes.
Yeah,
Yeah,
not a
yeah.
recommended modality to prevent all those things. Okay, so far as rightly mentioned, but this also another point. Okay, so what now we can do? USG will be to see the growth of the baby, perineal massage from 35 weeks onward, to strengthen your perineal massage and prevent perineal trauma and future prolapses. Can I arrange appointment with the consultant? Okay, now close the loop, document patient information leaflet regarding cesarean section, vaginal birth, tocophobia also, operative vaginal delivery, counselor, CBT, USG at term. Okay, exercise to keep your baby, means she can continue her exercises. Okay, she can continue all the exercises to keep her body, keep her abdominal muscles tight so that her body will be back to normal once she deliver. It is very important. Frequent follow up with the named midwife. Arrange visit to labor ward. This is one of the important point. Okay, so as we had arranged her meeting with, arranged means we had asked her to see the people who will be involved in her means whom she means who had similar situation or similar problems in the past. She can talk with those people also. There are various websites where she can also visit and arrange visit to labor ward so that her fears get little bit allayed. Okay, uh, means she will not be apprehensive regarding the labor birth. Okay, so anxiety UK support group is there regarding anxiety. Basically she's having anxiety, so I was just searching, there is one tocophobia leaflet, there is various PDF for regarding tocophobia. So they were saying some support groups are there regarding anxiety UK where you can means where you will get some information regarding tocophobia. So this is all about the task, information gathering, obtain relevant history that will be highlight the course of her pregnancy, her occupation requiring fitness, her ideas why it is very important. You asked me, ascertain the fear and worries of the patient, acknowledging anxiety issues, nightmare associated, confirm that this pregnancy is progressing without any issues or anxieties. Applied clinical knowledge. This much is well within that. Okay, so this Tommy's group is having this tocophobia information, that much is sufficient. Okay, communication with patient and families, introduce self and role, pros and cons of vaginal delivery, cesarean section, operative vaginal delivery, to be reviewed at 37 weeks of gestation. Regarding further decision, ultrasonography scan, discuss the risk of tear in vaginal delivery, especially in operative vaginal delivery, and this what you are going to do to minimize those. Discuss intrapartum monitoring while progress of the labor and fetal well-being. Information at a pace that allows comprehension and encourage questions. Refer to perinatal mental health specialist consultation if considered appropriate. Okay, counselor and perinatal mental health specialist, including CBT people. Patient details at the start of the task is patient safety. Negotiation on plan and informed choice. Okay, it will be her informed choice. At the same time, patient's autonomy will prevail. Delivery options, both vaginal delivery, cesarean section. Explain pros and cons of both. A certain fear and need for CBT, that is cognitive behavioral therapy. Rule out abuse and mental disorder, because sometimes there are certain mental issues or some abuse in the past. If you think she is not opening up here, you can just assure her regarding the confidentiality. Okay, that's it. That is all about this task. Very nicely done. Okay, few points here and there you need to improve here.
Yes, ma'am.